you guys for coming out today and listening to a little bit about my journey. I'm really excited to get to speak on this. I've been at Western for a long time now. It's my seventh year here. So I did my undergrad at Western, I did my master's at Western, and then now I'm doing medical school at Western. So I always joke with my friends that Western should like sponsor me at this point because they've taken so much money from me. But yeah, no, I'm excited to talk about a little bit about my experience today. So, hi everyone. My name is Noor Qureshi. I did my undergrad degree in genetics in 2023. I then completed my master's in global health systems in 2024, and I'm currently a medical student at Schulich, graduating in 2028. What I want to talk about today isn't just about my degrees, it's everything that happened around them. So, because if there's one thing that I've learned so far being in school for so long, is that your path is shaped just as much as what you build outside of the classroom as what you study inside of it. So, starting from the beginning, coming into Western, I knew I loved science, but I didn't know where to head with that. Through work experiences and a research internship at UCSF in California, I grew to love genetics. I was fascinated by precision, how one mutation can change a prognosis, how targeted therapy can alter survival, and how molecular diagnostics can transform care. I was drawn to the idea that if we understand biology enough, we can intervene with specificity. And so at that stage of my career, my questions were very molecular. It was stuff like, what is a mutation? How does it change protein function? And what does that mean for treatment? But I hadn't asked yet a more complicated question, such as who actually gets access to these types of treatments or testing? I've always loved global health, and I'm going to be speaking about that a little bit later. But those more complicated questions really started to happen when I was indulging myself in global health experiences. So I had the amazing opportunity to work in Kenya for a summer through Western to Heads East. And that's really when I started looking at healthcare from more of a bird's eye view. So I was evaluating operational health systems across different specialty clinics in Kenya. And so what struck me the most wasn't that there's a lack of expertise, but it's just how much care is depending on invisible infrastructure. I saw examples where international organizations that were based in Canada or the US were funding new clinics in Kenya. The buildings were very modern, equipment was donated. On paper, it looked like very good progress. But some of these facilities were placed in locations that weren't easily accessible to the local communities that they were meant to serve. Transportation costs were extremely high, roads were difficult. In some cases, community consultation wasn't even something that they even considered to begin with. So a lot of these initiatives were kind of being put in these communities without even asking the communities to begin with. So in other situations, services were introduced without fully integrating local cultural norms or leadership structures. So as a result, the community trust for these initiatives were extremely fragile, and therefore, like no one ever used them. So there was a lot of times where I saw very empty health clinics, despite local populations having high morbidity and mortality rates. And that never made sense to me until I really looked into the reasonings behind it. They just didn't trust the healthcare system. So the clinic existed, the funding existed, the intention was also good, but the system wasn't aligned with the community. And that's when I started to realize that healthcare was so much more than like a doctor providing clinical care. It was really about aligning those systems together. And that's what really pushed me to pursue a master's in global health systems. So at Western, there is a program, a master's in global health, and that's what I chose to pursue before medicine. And through that, my lens really shifted. And I am so grateful to this day that I took a year off to do this master's before medicine because it really helps me now when I'm a medical student, when I'm interacting with patients, because I got to learn about maybe the systemic levels of healthcare that, of course, medical school does integrate to an extent, but not to the extent that I think is needed. So during my master's, I learned a lot about studying governance, financing, supply chains, workforce distribution, and health policy. And my questions really evolved from being like, what is the mutation to like, who can access this test? Who can afford the transportation to the clinic? Who can navigate the system? And who gets left behind? And that's when I realized something very critical. Without strong systems, it doesn't reach the people that the initiative was intended for. So through my master's program, we had an amazing opportunity to work in Uganda. And again, this is where like a lot of those lessons that I learned in Kenya were just reinforced and deepened, and I like, got to explore more of those things. So in Uganda, I evaluated access to HIV medications among extremely vulnerable populations, so pediatric populations, sex workers, individuals from the LGBTQ plus community. And I had the opportunity to participate in community outreach. So every day I had the chance to go into these communities, learn from the community members, and see where the gaps were in terms of access to HIV medication and preventative measures. So on paper, antiretroviral therapy, which is what is used to treat HIV, is available. It's available all across Uganda, and it's actually a law that it should be free. Programs do exist, and the guidelines are really clear. But what we see is that despite all of this, what on paper looks like good access, these communities are still struggling with new HIV infections. And that's like when I learned by communicating with community members, it's because reasons such as transportation costs, the stigma, the economic instability, and the family dynamics behind actually even accessing these medications. So what I learned was availability does not always mean accessibility. And what I saw was a healthcare system that understood its population deeply. It adapted through outreach, education, and partnerships. But I also saw how even strong systems must continuously respond to the social context around them. You can't design effective healthcare without understanding those community dynamics. Um, Trying to change my slide. Ooh, okay, there. No. Okay. So here I just wanted to talk a little bit about things that I did, during my degree that just made me happy and also made me like develop a lot of different skills that I think are very useful to me today too. So I was born in Kashmir, which is a mountainous region between India and Pakistan, where geography alone can determine your access to healthcare. In many areas, it's not just about whether a doctor is available, it's about whether you can physically even reach them. So roads, infrastructure, distance, these are the health determinants that determine whether individuals can even have access to care. So even though I grew up in Canada, that awareness always stayed with me. Where you are born basically shapes what is possible. And so when I came into university, I knew I wanted to do medicine. That goal felt very clear to me, but I didn't know where I fit. Like I didn't know what doctor I wanted to become, and I still don't, which everyone is telling me is okay, so I'm just trusting that. But like many pre-med students, maybe some of you guys are on this call today, you feel pressure to build that perfect application. You want to pick the right research, you want to join the right clubs. And at the same time, like I just knew I couldn't force myself to do things for an application because I didn't enjoy them. So I had grown up playing competitive volleyball, and sport was a huge part of my identity. It taught me discipline, it taught me resilience, teamwork, but it also showed me what it feels like to not always see yourself represented in certain spaces. So, as a Muslim woman in competitive athletics, there were moments where I was very aware that I didn't fit that mold. So, when I entered university, I had a choice. I could either like take these experiences and compartmentalize them and treat them separate to my academic endeavors, or I could actually lean into it. And I knew that this stuff made me happy, so I just chose to lean into it. And that's how I ended up creating a volleyball program right here in London, focused on increasing inclusivity and representation for young girls in competitive sports. So, what we do is that we hire a lot of diverse coaches and we break down those barriers in terms of cost so that young girls are able to participate in sport. Especially racialized girls and girls from low economic social households, just because sports is very expensive on its own. And so that stuff made me really happy. This was something that wasn't strategic. It wasn't designed to look good on an application for medicine. It was something I genuinely care about, and I still care about so much. I still continue to coach in this program, even in medical school. And through coaching, I saw something that changed how I actually think about equity on its own. So what I noticed is that talent is evenly distributed, but opportunity is not. And this was a common theme that kept coming up even in my time in Kenya and Uganda because it applies to healthcare. Because if you don't have the opportunity, you're never able to be even given that chance to pursue things that you want to pursue or even pursue that healthcare or like get access to that healthcare. So on this slide, I wrote be unapologetically yourself through the entire process. And what that means to me now, looking back years and years of like grinding to get into med school, is just allowing your lived experiences to guide your academic and professional path instead of trying to erase them to fit a mold. The reason I'm now working in the research projects that I am, which I'll get into in a bit, pediatric oncology at SickKids, isn't because I followed a formula. The reason I wanted to get into med school wasn't because like I followed a certain formula. It was just doing things that truly made me happy. And those early experiences in sport, in community, in understanding access are the exact things that shape the physician and then the researcher I'm becoming. So I'm very grateful now, especially because time is limited in med school, I would say. Like looking back in undergrad, I had a lot more time to pursue things that I like. And still now, it's like you make time for stuff that matters to you. But obviously it's a bit different, but I'm so grateful for my time in undergrad and my master's that I really had the time to pursue these things and learn so much more about myself. So right now, just touching on the research that I'm currently doing, I'm a full-time medical student, but I'm also conducting research at SickKids. I'm working on a scoping review examining access to molecular diagnostics for pediatric cancer patients in low and middle income countries. And this is like the perfect project for me because it's really connecting my interest in genetics because I'm looking at genetic testing and then also connecting my everything I learned in my master's in global health and then bringing in that medicine aspect into it. So I'm very grateful for this opportunity and all my colleagues at SickKids who are allowing me to pursue this project. And what we're looking at is that we're looking across the world what currently exists for pediatric cancers in terms of diagnostic techniques. What we're finding is that the very good diagnostic techniques that can literally save children are often situated in high income countries, while low and middle income countries don't have access to that. So we want to build policies to increase that access, increase those partnerships. And so now what questions I'm asking when I'm looking through it through a lens as someone in medical school, but having had these experiences, is that is this model sustainable? Does it build local capacity, or does it reinforce the dependency that LMICs may have on HICs? So the skills I've been learning throughout this project at SickKids, this work definitely requires my background in genetics and genetic testing just to familiarize myself with what's being done. I need to be able to comparatively look at health systems, and I need to be able to translate molecular science into the policy relevant language. But honestly, I think with a lot of global health work, the interpersonal skills matter just as much, if not even more. So being able to be humble in international collaborations, listening before proposing solutions, recognizing local expertise, and coordinating multidisciplinary teams. Global health research is not about being the smartest person in the room, but it's about building a room where multiple perspectives can shape better solutions. And so now a lot of people ask me, what's medical school like? Medical school is a lot of work. It's intense, it's very, very humbling, and it's structured chaos almost all the time, but it's also very deeply meaningful. What surprised me most is how interconnected everything feels now. Genetics isn't like a strange or maybe like a far off concept to me anymore. It's very clinical, like I see it in patients. Health systems aren't theoretical, they're visible in patient outcomes. And equity isn't just a concept anymore, it's actually something that's tangible that we can work towards. So medical school really forces you to confront the human side of everything that you've studied. And like I finally feel now in second year, everything's coming around in a full circle where I get to actually connect genetics, global health, and then medicine itself, which is so amazing. So, if you're interested in global health research or even medicine in general or equity focused careers, one advice that I do have is learn how systems work, whether it's molecular systems at the cellular level or health systems, because sustainable change happens at the structural level. So, learning how systems work, being okay with being uncomfortable. So, when I was going to Kenya and Uganda, these were very new experiences for me. I didn't know anyone in Kenya or Uganda. And I was okay with being uncomfortable, maybe being exposed to certain situations that I haven't been in Canada. But I found that I learned the most about myself and I progressed the most in my career that way, just being open to change, being open to different narratives. I would say one advice that I say you shouldn't do is don't chase visibility. So, global health is not about traveling somewhere and taking pictures and having an awesome time, even though sometimes like that might be a result. Like it's about really contributing responsibly, collaboratively, and sustainably. What I've learned is impact is a lot quieter and slower than you think, especially in global health. So you need to have a lot of that resilience, and you need to understand that a lot of the work you're doing now, you might not actually see come into existence until much later. So, if I could summarize my journey so far, it would be that science gives us the tools, and then systems determine who benefits from them, and then leadership determines whether change is actually sustained. So, from this whole series, I think your degree definitely matters, and you're paying a lot to be here. So, I'm not going to say it doesn't matter because it does, but who you are, what you build, what you care about, and how you lead matters just as much. So, thank you. I can take any questions that you guys might have.
Thank you, Noor. That was fantastic. Just for everyone in the call, I've known Noor since she did her internship in Kenya with Western Head East. So I do really appreciate all the measures you're talking about, the importance of equity in this collaborative approach. Yeah, thank you. That
No
was
problem.
great. I'm gonna stop the recording actually right now so we can take some questions.